Good morning.
Good morning.
So, following up, what are the duties and responsibilities of someone working in this occupation?
Well, some of the things that I have to do are examine patients who have hearing balance or related ear problems, assess the results of the examination and diagnose problems, determine and administer treatments to patients' goals, provide treatment for tinnitus, a condition that causes ringing in the ear. I fit and dispense hearing aids, counsel patients and their families on ways to listen and communicate, such as lip reading or through technology. I evaluate patients regularly to check on hearing and balance and to continue or change treatment plans. I record patients' progress. I research the causes and treatments of hearing and balance disorders, and I also educate patients on ways to prevent hearing loss.
That's a lot. Anyways, what do you like about this occupation?
Well, one thing that I absolutely love about this job is seeing the faces of my patients when they hear sound for the first time. I can't help but tear up every time. It is something really rewarding in this occupation. That is one of the reasons why I became an audiologist.
That's cute. What do you like? What do you dislike about this occupation?
One thing that I would definitely dislike about this occupation is all the research that I have to do. Sometimes. I get distracted very easily, which means it is hard to me to do research.
What is your educational background?
Well, I have a doctoral degree in audiology, a bachelor's degree in biology. You can have a bachelor's degree in any related field. And I have graduate coursework from diagnosis and treatment, which you can also graduate. You can also graduate from any coursework in any related field. And I have had supervised clinical practice, and I also have a license to practice audiology.
What is a typical day like for you?
Well, I usually work full time, so that consists of 40 hours a week. And that also includes using audiometers, computers, and other devices to test patients' ability and balance. I also work to determine the extent of hearing damage and identify the underlying cause. One thing that I do is measure the loudness at which a patient begins to hear sounds and the patient's ability to distinguish between sounds and understand speech.
What is the salary range for someone in this occupation?
Well, an audiologist typically earns $75,920 per year, which is $36.50 per hour.
Wow, that's twice the amount they pay me. What is your most satisfying experience so far?
My most satisfying experience, so far has to be learning about how much this occupation will be growing in the near future, which is 16% between 2018 and 2028.
What advice do you have for someone considering this career field?
The advice that I would give is to get as much on-hand training that you can get as early as you can, such as being a part of a STEM school that offers biomedical science as a pathway, because within that pathway you will be learning and experiencing many things that other people don't experience until they are in college or even in medical school.
Do audiologists perform surgery?
Audiologists do not perform surgery, and we also do not prescribe medications such as prescription drugs.
What is the difference between audiologists and ENT doctors?
Well, an audiologist only deals with the ears, and ENT doctor treats patients for diseases or conditions of not only the ears, but also the nose or throat. An audiologist focuses on hearing loss and related problems like tinnitus or balance issues. ENT doctors generally do not treat hearing loss.